So we're going to talk about the beginning. So you go to the physician, or your loved one goes to the physician, and with maybe a cough or a tickle or something, maybe an upper respiratory infection, a cold that doesn't get better. And so your physician orders a chest x-ray, and this is where it usually starts. And he sees something here, and there's something there that looks like what we call a lung nodule. It's very small. And this is how the workup starts. And you've been told you have a lung nodule. So what does this mean? As you can see here, a small nodule and risk factors such as active smoking history would indicate that you should have a low-dose chest CT scan of the lungs. And we're actually, a small nodule, we're actually following the NCCN screening guidelines, which are not actually in this booklet, but can be found on the NCCN website for patients. And if your chest x-ray indicates a medium-sized non-small cell nodule, and we're talking very small actually, a centimeter or so, but it's non-small, it's non-solid, you would want to have a low-dose chest CT as well. A medium-sized CAT scan, you should get a CAT scan initially and then follow it up within 3 to 6 months as well. And then if there's a larger nodule, and we're talking maybe greater than, actually greater than 1.5 centimeters or so, you would want to see a surgeon. You would want to have a full-blown, what I call full-blown CAT scan, which is not a low dose. The low dose is less intensity, and you would want a regular CAT scan. And as we talk about CAT scans, this is essentially what it looks like. This is a CAT scanner, or a CT scanner, and you're given dye to get a good image of how thick the nodule is. It measures the size and the depth of the nodule, and this kind of gives you this gives the provider an idea of where to go next. And you can find this in part 2 of your booklet. After you found the nodule on a CT, your physician would probably order a PET scan. Now, a PET scan is you're giving what we call glucose uptake dye. Cancer has its own metabolism that utilizes the dye, and as you can see here, cancer lights up. And we practitioners oftentimes will say, oh, that lights up on PET scan, and this is what we're referring to. There are some organs that light up normally or illuminate normally. But what we look at is it's given, the ultraviolet light is given a value, and we're looking for something greater than a 2 that may indicate that something is cancerous. And Dr. Otterson will be going into these a little more in depth in his talk.